Hey, welcome to Usmle Point. Today I'm going to discuss briefly about a 25-year-old man with abnormal breasts and infertility. So you could see I have written the hyperprolactinoma. This is a topic I'm going to talk about. I'm not going to talk in detail like a theory lecture. Just I want to tell you about the important points with regards to Usmle examination. Let's start. Let me brief you with this hyperprolactinoma. There's a microadenoma and the macroadenoma. Micro less than 1 centimeter and the macro is a more than 1 centimeter, right? So the important thing, like the most common cause for the hyperprolactinoma is pituitary adenoma. Remember this, pituitary adenoma is the most common cause. Okay, there are many causes for hyperprolactinoma, like if the patient is taking drugs like phenothiazines, metoclopramide and alpha methyl dopa, SSRIs, tricyclic antidepressants. So normal physiologically, you see in patients with if they are nursing mothers, hypoglycemia, seizures, cirrhosis, chronic renal failure, any nipple stimulations, this will cause hyperprolactinoma. So what Usmle asks you, that's what I'm going to tell you. Usmle point. Remember, they will ask you they will give the history of hyperprolactinoma or pituitary adenoma, and they will ask you which of the following laboratory finding you would like to see or you would like to do for this patient other than checking prolactin levels. What's that? That's a TSH level. Remember this is very important. TSH is very important. You need to check before diagnosing prolactinoma or before starting therapy for prolactinoma. Remember, because this TRH, the TRH that stimulates the prolactin release also. So TRH stimulates the release of TSH and also prolactin. Okay. Let me send next slide. Okay, Usmle point. The Usmle point is they will ask you whether drug or surgery is good. They will give the long history and they will tell you that the patient asks you how about the response to the therapy. So they will give the drugs. Drugs usually do good prognosis with the drugs. Drugs usually the patients respond very well to the drugs. Remember this is very good response from the drugs rather than surgery. Rarely they need surgery. Those who fail with the treatment with the drugs, they will go under surgery. Okay, the drugs what we use are carbapenem and bromocriptine. Okay, if carbapenem and bromocriptine they are not effective and the tumor is associated with a significant compressive neurological effects, then radiation is used if drug therapy and surgery are ineffective. So first is a drug, then surgery. If both are ineffective, go ahead with the radiations, right? So this is very important. Normally the prolactin levels are more than if prolactin levels are more than 100 nanogram per ml, then is probably the pituitary adenoma. This is very important. This is very important point you need to remember. Okay, let me see. Okay, how they respond to the treatment I discussed before. Just let me know how do you feel about this video. Comment, subscribe and like. Thank you so much.